Hey everybody, we've got another specimen today. This is number 1231 in our collection, and the heart would have sat in the chest roughly like this. Anterior surface would be coming out towards the screen. The posterior surface would be towards the turntable. The head or superior would be here. Legs are inferior here, left over here, and right over here. You can see that this specimen has the trachea still attached to it, and also the lungs as well. Now, just externally looking at this heart, right off the bat, it appears that the great vessels seem to arise side by side, indicating that this is very likely a congenitally malformed heart. And we can also see evidence of some operations here. There's a pulmonary artery band. And then when we look to try to find what appears to at least externally be the right atrial appendage, we find a structure that is broad-based, pyramidal, or triangular in shape, consistent with the morphologic right atrial appendage externally, and we find that there is a suture line in that as well. But let's do what we normally do and start with what we think will be the morphologic right atrium. And when we open up this atrium, we do find pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. And we do find that there is a superior caval vein right here, which drains into the right atrium and connects to this morphologic right atrium at its superior aspect. Now, when we look at this superior caval vein here, we do find another vessel, which is right here, which drains from posterior to the heart, comes up, and then drains into the superior caval vein. And this appears to be ligated here as well. So we'll keep that in mind because this could potentially be a vertical vein, indicating that there might be total anomalous pulmonary venous connection. Now, when we go back into the right atrium, it's difficult to really identify an oval fossa, but we do find two orifices back here. One is down here, so we'll go ahead and pass our probe through that. And when we pass our probe through that, we find that it actually leads to this structure here, which actually appears to be, at least externally, consistent with a left atrial appendage. So it appears that the left atrial appendage actually connects to the morphologic right atrium, which also then has an appendage that's consistent with a morphologic right atrial appendage as well. And then immediately superior to the mouth of what appears to be the left atrial appendage is this structure here. And if we pass our probe through that, we actually find that we enter what appear to be pulmonary veins. So the pulmonary veins in this heart have been anastomosed surgically to the back wall of the morphologic right atrium. And remember, there was a question of whether or not there was going to be total anomalous pulmonary venous connection, because we had earlier seen what looked like a vertical vein draining into the superior caval vein, which had been ligated. And we find that structure here. So here is that vertical vein here. Here's the point that it's been ligated at or tied off. And you can see here is the superior caval vein, which then drains into the morphologic right atrium here. But why don't we take a look at the backside of this heart, since we've now identified the pulmonary veins. And so here we see the pulmonary veins. Here's one, here's 2, 3, 4. And you can see that they drain back to a confluence here. And that confluence has now been anastomosed to the back wall of the morphologic right atrium. But here is that vertical vein that we saw from the other side. So originally, all of these veins drain together into this confluence, which then drained into this vertical vein, which then coursed superiorly and then drained into the superior caval vein. So total anomalous pulmonary venous connection, and more specifically supracardiac total anomalous pulmonary venous connection, and the venous confluence has been brought back to the posterior wall of the morphologic right atrium. And now when we look at the right atrioventricular junction, we see that it is in fact guarded by what appears to be a 3-leaflet valve, and this valve does appear to have septal connections consistent with a morphologic tricuspid valve. Now we'll turn our attention to what appears to be the morphologic right ventricle. And here you can see there's coarse trabeculation, what appears to be a septomarginal trabeculation, consistent with a morphologic right ventricle. The ventricular septum itself appears intact. There doesn't appear to be any sort of an interventricular communication. And interestingly, we see that both great vessels arise from this morphologic right ventricle. So here's one great vessel, here's a second great vessel. And while we look at this one, we can see that this in fact is the aorta. So here is the aortic valve. And if you look here, you can actually see one of the coronaries arising kind of high within the sinus. But here is the aortic valve, here's the ascending aorta, here's the transverse aorta, and then here is the descending aorta here. Here is the pulmonary valve, and here is the pulmonary trunk. And you can see that the pulmonary trunk arises side by side to the aorta, and that the pulmonary trunk is in fact leftward to the aorta. And the pulmonary trunk does give rise to both the left and the right branch pulmonary arteries. And you can see that there has been a pulmonary artery band surgically placed, presumably to help limit pulmonary blood flow during life. So both the aorta and the pulmonary valve seem to have completely muscular support, meaning that there is aortic infundibulum and that there is pulmonary infundibulum. So this heart has double outlet right ventricle with an intact ventricular septum and bilateral infundibulum. And there is an outlet septum here between the aorta and the pulmonary trunk. Now, we won't spend too much time on this, but interestingly, there isn't really evidence of a left atrium or a left ventricle. Here's the posterior aspect of this heart here. Here's that atrial appendage that appears to be consistent with the morphologic left atrium. It is possible that there's a rudimentary ventricle here, and sometimes looking at the outline of the coronary arteries can help kind of demarcate where a small primitive ventricle might live. And some additional dissection might help identify if there is one. But now from the backside of the heart, once again, we can see the pulmonary veins. And all the pulmonary veins here return to this confluence. And this confluence has been surgically anastomosed to the backside of the morphologic right atrium, but originally had drained via a vertical vein, which is right here. So they all drained into a confluence, which then drained via a vertical vein to the superior caval vein here. So an unusual heart with double outlet right ventricle, an intact ventricular septum, with a pulmonary trunk that is leftward of the aorta, bilateral infundibulum, and supracardiac total anomalous pulmonary venous connection, which underwent an anastomosis of the pulmonary venous confluence to the right atrium and a pulmonary artery banding.